Good evening. This is Dr. Thomas Klein in Raleigh, North Carolina. I have been practicing 45 years, and my interest over the past 7 years has been rare painful diseases. The CDC guideline that was written for chronic pain didn't know that these diseases existed. There's 20 to 30 rare painful diseases, none of which have cures, all of which require treatment of the pain and inflammation, and lo and behold, opiates, or pain medicines as we're using the term now, have anti-inflammatory properties. What a perfect drug. And why has it been demonized? It's been demonized by a campaign of disinformation and fear-mongering. And we're going to talk about that later. Sure, there's a problem, but it's not nearly the size that's portrayed, and it does not involve people with pain treatment. People treated with pain medicines have been said 25% are addicted. That would be 2.5 million people. There's actually only about 900,000 heroin addicts. The testimony has been given in courts that the addiction rate amongst pain patients is 25%. Actually, the addiction rate in people being treated with pain medicine is 0. And we'll talk about that at another time. This is the email address for National Pain Council. If you wish to write us about anything, make suggestions, criticisms, whatever, feel free to do so. Today we're going to go through some polls or surveys that we've been doing through Twitter. Now, when I say that we're using Twitter polls, people hair stands on end. No, you can't do that. They're no good. These are like sidewalk polls, and nobody's doing them. So if somebody's got a better set of polls, hey, we're happy to modify our polls. The numbers themselves are not critical. The numbers indicate whether it's a few, medium, or a lot. And we stand behind these polls because we watch them as they're developing and the stability. And also these polls are correlating with what we hear. So these are the polls that I have been running as a senior advisor to the National Pain Council, and then I turn these over to the National Pain Council for analysis. So I'm just going to go through some of the polls that we've done, and if we run out of time and we have more, we'll have another session. And this is a part of our Monday series of discussions coming from the National Pain Council and coming from JATH Educational Associates, presenting the truth. There's lots of people out there presenting the truth, and we're one of them. And we research everything. Everything that I say can be supported. If I make a statement that cannot be supported, I will say I'm making an opinion. These are not my opinions, these are facts. So let's take a look at this survey. We did this a while back. How many of the people responding on Twitter have painful disease? 85%. So this is a pretty good pool of people. There is no other pool of people with painful diseases. Only 4% were just observers. People with rare painful diseases have an unusual symptom that sets them apart from other diseases. They can't take showers because the water spray hurts their skin. It's a weird kind of thing called allodynia, D-Y-N-I-A, allodynia. And what we wanted to know was if you're being treated with pain medicine, as we know is partially anti-inflammatory, Did it help with the allodynia? 75% of people, in other words, the majority of people said it did help. So it looks like pain medicines are just as powerful anti-inflammatories as they are pain medicines, which makes them ideal. How many of you with rare painful diseases, we asked, have had to curtail your driving? 11% said there was no problem. All the rest had a problem, including 40% that had to stop driving because of untreated pain and inflammation, easily relieved with our oldest medication, going back before the pyramids, pain medicines. And these are opiate pain medicines because there's only one other pain medicine, and that's Tylenol. So when we talk about pain medicines, automatically the heavy-duty medications. How many of you have seen improvement in your medication status for your rare painful disease? 24% said some small improvements, only 3% said big improvements. So taking people off without consent from their medications is negligent malpractice. And we're trying to encourage people to go back on, and we are preparing some papers at the MPC, National Pain Council, to help doctors put patients back on and not be afraid they're going to be dragged off to prison for 20 years. How many of you patients with level 3 pain, which is severe, have applied for Social Security? This shocked me. 60% of people with rare painful diseases no longer treated now become disabled and are applying for Social Security. And most of them are getting it because untreated pain is one of the commonest reasons to be put on Social Security. So there's kind of a downstream problem from the CDC. This is a CDC fallout that they're creating. I mean, there's 10 million people with this disease. If 60% or 50% or even 40% are applying for Social Security, might want to look into the cost of that. And the fact that their lives are so wrecked by the CDC encouraging doctors to take people off, in spite of the fact they said they didn't. The way to find out if CDC is really responsible for this is not arguing back and forth. It's very simply removing the CDC guidelines from the picture. Would have all this happened? Would people be committing suicide? Doctors going to prison? Nope. We believe that there's no one that's addicted once they're on their pain medicines for more than a month. So we asked if anybody knew of any patients that became addicted once they're treated, and the answer was nope, nobody. Problems in the pharmacy, 61%. It's a lot more common in the big chain pharmacies than it is in independents, and we do at National Pain Council recommend that people go to independent pharmacies. Also, oddly enough, the drugstore, the supermarket pharmacies seem to be more understanding of people with these terrible problems. Here it is. CVS and Walgreens were 70%, 14% problems at food chains, and 10% at independents. Now, just have time for one or two more, and we can continue these maybe the next time, because I think these are valuable and I believe in them, and I think they're accurate enough to stimulate more research. Now, we notice that people with these terrible pain syndromes seem to have a lot of surgery, and reasonably so, because you've got a difficult problem and you think, well, maybe surgery's the last. But the problem is that 3/4 of people that have undergone surgery for their chronic pain disease, now there's not specific things, this is not pain down your leg, that's a slip disc. This is part of our painful disease syndrome group. The 75% surgery failed. So I'm going to end there for the evening, and good night.